Medicare is changing in a big way in 2026, and if you're on Medicare, chances are you already know that because you have been notified about plan changes, including price increases, more out of pocket on your drugs, and worse, maybe you're losing your plan altogether. And this can be a very stressful time. We're seeing a transition in the Medicare program that we haven't seen in a very long time, if ever. And after talking to many people now that open enrollment has started, there are a couple key things that you need to be aware of before you start shopping for new coverage. My name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people understand how the Medicare program works, and I connect them with the coverage that fits their needs. And when you talk to as many people as I do on Medicare, you start to notice a theme develop. And there are certain questions that you can ask almost everybody about what they understand about their Medicare coverage in order to secure the right coverage for the coming year. And there are a few key things that you are going to need to know. You're going to have to figure this out in order to find the coverage for 2026. I'm going to list a few of these. These aren't all of them, but I'm going to list 3 of them. And you'll want to make sure you hear all 3 so that you ensure that you get the coverage that you need for the coming year. So some people call my office because they just want a comparable plan to what they've had. And so the number one mistake that I see happening with people in this category is this. They don't know the benefits of the plan that they're losing or the plan that's changing, quite honestly. So when you sign up for a Medicare plan, whoever signs you up for that plan is required to send you what's called the summary of benefits or the outline of coverage. And it's within that information that you get to see how much are the co-payments going to be at the doctor? How much are how much are the co-pays at the specialist? What is the co-pay if I'm admitted into the hospital? What is the co-insurance on my Part B drugs? That's a big one because that usually has to do with chemotherapy. Almost without exception, every single person I talk to can't tell me what those numbers are, and they don't even know where to locate it. Now, that's not a criticism. It's just a reality about shopping for a new plan. You have to start from somewhere. So if someone calls me and says, I want a comparable plan for 2026, I have to be able to know, what am I comparing this to, right? And if I don't know it as an agent and you don't know it as the one who has the policy, then we're kind of going to be in a difficult situation. Now, here's the thing. I don't mind walking people through this and helping them with that, but I just want to put this video out there for others of you who are going through this. Track this down. You can call your current health insurance company and say, hey, where is the summary of benefits? Where is the outline of coverage? Can you send that to me? And it's a chart. It just breaks it down for you, and it just shows you those co-payments, the co-insurance, the deductibles, and then you can begin to compare it. And the reason that's important is, let's say that on your policy, you had a co-payment of a certain dollar amount per stay at the hospital. So I'll just throw this number out, for example. Days 1 through 5 are $400 if you're admitted into the hospital. Well, if you go and just pick up another plan, which a lot of people do, and it's $400 per day, now you have potentially tripled or quadrupled your cost, right? Because you went from $400 per stay for days 1 through 5 to even $300 a day. That is a lot different. The other thing is, if you go to your primary care physician and you don't have a co-payment and you just grab another plan, that plan may have a copayment now. And so now the next time you go to the doctor says, okay, today your copayment dollar is $25 or $15, whatever it is. You're going to go, what? I've never had to pay a copayment before. Well, again, this is what you have to compare, which leads to the second thing. Are your doctors, specialists, clinics, hospitals going to accept this new plan? One of the things that agents get in trouble for is they don't help people ensure, and this is on a Medicare Advantage plan, that their doctors are in network, their specialists are in network, their clinics, their hospitals. And so it's on an insurance agent to help ensure that your providers are in network. And it's amazing how many people don't know who their primary doctor is. I've had that happen a couple times. They can't remember that person's name, or they don't have their address, or they haven't been there in a long time, and that doctor's not even there anymore. So you're gonna want to make sure when you're looking for this new plan that your doctors, your specialists, your clinics, your hospital, all of that is in network. This could be a case where someone signed up for a plan several years ago, didn't do this in the beginning, and they just kind of navigated it on their own trying to find a doctor that would take that plan. You can do this ahead of time for the coming year, and it's something that you definitely would want to do. And then the last thing that I'll mention, a mistake you want to avoid, is not understanding how prescription drugs work. So a lot of people are getting notified that their premium on their Part D drug plan is going up. And so they're immediately running to an agent or a broker, or they're running to Medicare.gov and they're saying, I need a cheaper plan. Now, here's the thing. I understand that. I like a good deal as much as the next person. But I want to go back to my first point and say, if you're not careful, you may purchase a plan, a prescription drug plan, that actually has more out-of-pocket costs, even though the premium is lower. So you say, well, how does that happen? Well, Part D prescription drug plans can have a deductible, and those deductibles are going up. We're seeing that. The other thing is, depending on what prescriptions that you're on and what tier they fall under, there's 5 tiers for prescription drugs usually. If one of those prescription drugs falls into a higher tier, you could potentially have higher out-of-pocket costs and not know it. The other thing I would say with prescription drugs is you want to look at more than one pharmacy. So you want to make sure that the pharmacy that you're choosing has the preferred pricing. And you can actually, when you shop for a prescription drug plan, look at more than one pharmacy. And I highly encourage you to do that, because I've talked to people on Medicare and they said, I went to this pharmacy for these prescriptions because the cost was this much, and I go to this pharmacy for this prescription because the cost is this much. This is a time where you're going to have to take some initiative to do some research and to really, really understand. This is changing. How do I slow everything down, take the time during the open enrollment period to review all of my options to make sure that I have the right plan for the coming year? And that's something I can help you with. There's probably agents and brokers in your hometown that can help you with that. You don't have to do it alone. There are people out there that can help you, so you're not navigating this alone. People who do this every single day, not just in October and November and into December during the open enrollment period, but all year long. Don't skip out on using that expertise that's available to you. I hope you found this video helpful. If you did, Be sure to subscribe to the channel, and if you have any questions about Medicare, leave them in the comments below or reach out to me through my website. It's just meetjamie.com.